Okay, students, we'll be talking about some the molecular structures no, that are important in our body. So if you can notice in your SAS, there are dimension there of your phospholipids and then your protein, and then you also have your cholesterol and then your carbohydrates. So class, when we talk about phospholipids, as you can notice, your phospholipids would have two ends. There is what we refer to as your polar region at saka we have your non-polar region. So guys, when we say polar region, is it water-loving or water-fearing nga ba siya?
Water loving.
Okay, so class ha, pag sinabi kong phospholipids, so meron po tayong again, dalawang section for that. And the two sections for that is you have your polar at saka you also have your non-polar. So tulad ng sabi ninyo, pag sinabi nating polar, it's considered to be water-loving. Okay? Pag sinabi naman nating class na non-polar, it's considered to be water-fearing. Okay? Ayaw niya ng water. Kung kaya may term kayong ginagamit, ang tawag po natin dyan is hydrophobia. Okay? Or hydrophobic end of your phospholipids. Now, another term class or another molecule that you will encounter is protein. If you can recall in chemistry, how do we represent your protein, dear students? Is it represented by CHO or is it considered to be CHON?
CHON.
Okay, tama na. So pag sinabi natin class na protein, we usually refer to it as CHON. It's just a reminder that it's composed of carbon, hydrogen, oxygen, and then this one unique component that could not be found in glucose, which is your nitrogen. Okay, so that's one of the products class of your protein. Kaya later on, when you will be studying, you would notice that the byproduct class of your protein metabolism is your nitrogenous bases. The byproduct class of your protein metabolism is your nitrogenous bases. Okay? Now, your nitrogen is actually excreted from our body through your urine. Kung kaya, pag may problema po tayo sa kidney natin, usually the protein is staying in the body, the nitrogen will be staying in the body, it could be also poisonous on the part of your body. Now, cholesterol. When I say class cholesterol, there are actually two main types of your cholesterol. May tinatawag po tayong good cholesterol at saka bad cholesterol. For your cholesterol, that two main types could be referred to as your HDL or LDL. Pag sinabi ko class na HDL, it is your high density lipoprotein. Pag sinabi ko pong LDL, it is your low density lipoprotein. Now guys, sino pong considered na good cholesterol sa kanilang dalawa? Is it your HDL or LDL? Sige na.
HDL.
Okay, very good. Okay, very good. So class, your good cholesterol is actually your HDL. Okay? And then plus your bad cholesterol is actually your LDL. So kadalasan kasi as lay people dati, we would think that ay cholesterol masama yan, hindi yan kailangan ng katawan natin. So let's correct that notion. And then when I talk about cholesterol, dear students, you need to find out whether it is HDL or LDL. So if it is high density lipoprotein, we usually say since it's high density, we would want it to be high also for us to remember that it is considered to be your good cholesterol. Okay? Our body needs this type of cholesterol, which means class that if our body needs this type of cholesterol, it needs to be taken. It needs to be taken. Palagay nyo, what are the sources of your good cholesterol? Give me possible sources of your good cholesterol. Can anybody try? Sige. Kasi sinabi ko yung cholesterol good. Baka mamaya kakain na kayo ng lechon.
Fish oil, sir. Fish oil.
Very good example. Okay? Very good. That will be your fish oil. Okay? So class, if you can notice to, if there's an elderly in your family, or if you have family with cardiac problems, or if you have family with nerve problems, oftentimes they are prescribed with your fish oil because your fish oil class is considered to be good cholesterol. Other than that, pag sinabi nating halimbawa, chicharon, pag sinabi nating lechon, taba ng baboy, those cholesterol classes already considered to be bad cholesterol. Okay? Now, what happens class with your bad cholesterol? Ito po yung pinagkakaingatan natin sa blood cholesterol. Halimbawa, dear students, this is your blood vessel. Okay? Picture that circle to be your blood vessel. From that blood vessel of you guys, no, ano pong pwedeng mangyari sa blood vessel natin? Ang isa pong pwedeng mangyari sa blood vessel natin is that, okay, once there will be LDL, your LDL kasi will be with your blood. Okay? Sabayan ng dugo natin. But since class it's low density lipoprotein, the tendency is that it will be attached to the walls of your arteries and it will be attached to the walls of your veins. Okay? It is attached to the walls of your artery and your veins. And with that attachment class, ano pong nangyayari? May mga taba po na nagsistay dyan sa artery natin. And that taba, okay, once it will be staying there, it narrows class. It leads towards the narrowing of your blood vessels. Okay, it leads towards the narrowing of your blood vessels, and we refer to that condition as your atherosclerotic plaque. Okay, so you have class that condition being referred to as atherosclerosis. Okay, so yan po yung problema natin if your patient would have fat deposits. Now, let me see if I can pick a picture of your fat deposits. Okay. So, class, ang makikita po natin dito, okay, magpapakita tayo. Para you will be able to appreciate kung ano yung sinasabi ko. Okay? Hindi ganong plaques, ano. Hindi ganon ang plaques na tinutukoy natin. Okay? Atherosclerosis. Okay, this one class, if you would look at that image, no? Okay, if you would look at this image, this already deposition of your plaques. Okay, ito po yung plaques, yung mga yellowish. On the left side class is your normal artery. On the right side, you would notice that there are already yellowish deposits. Okay, those are actually your fatty deposits. So what happens class? Wherever there will be an increase of your fatty deposits in your blood vessels, as I have mentioned, there is narrowing of your blood vessels. Eh ano ngayon kung magnanarrow yung blood vessels natin? Once class, there will be narrowing of your blood vessels. What do you think happens to the oxygen supply of your patient? Is it increased or decreased?
Decrease.
Okay, very good. So class, what happens is that yung oxygen supply natin bumababa. And because of the decrease of the oxygen supply, your patient would have that condition referred to as hypoxia. Okay? Pag sinabi nating hypoxia, decrease of oxygen. And then your patient class would have the condition referred to as hypoxemia, which is the decrease of your oxygen in your tissues. Pagkatapos, if you would look at the image class, kung nakikita ninyo, ano po yung nagde-deposit kasabay ng fatty deposits natin. Nagsasabay po yung tinatawag nating blood clots. Okay? Nagsasabay po yung tinatawag nating blood clots. Okay? Now, if you can recall in your simple sciences, when we talk about blood clots, blood clotting happens, di ba? Kapag may sugat tayo, if there is some injury in our part of the body or some bleeding, it is the clot that will stop this bleeding. However, class, in this case, the problem is not the bleeding, but class, the clots are depositing because of the fats that could be found here. There are a lot of fats that could be found here and it traps your clot. And what will happen? Class, your clot will continue to stay there. While your clot is staying, it's being referred to as thrombus. Okay, a clot class is referred to as thrombus. But once the clot class will be traveling, it's already being referred to as an embolus. Okay, once class the clot will be traveling, it's referred to as embolus. Ano ngayon sir ang problema kapag magta-travel ang clot? Class, if this clot will be traveling, it can impede blood flow in your small blood vessels. Again, it can impede the blood flow in your small blood vessels. Okay? So kindly write it down. Once we are talking about your embolus, okay, or emboli is plural, it can impede the blood flow of smaller blood vessels. Eh ano ngayon class, pag mai-impede yung blood flow ng smaller blood vessels, dyan na po pumapasok si myocardial infarction na commonly tinatawag po nating heart attack. Dyan na din po pumapasok si CVA. Kay CVA is cerebrovascular accident na commonly tinatawag po nating stroke. Okay? So kung kaya, that's why we educate our patients that's supposed to be, we are not to eat a diet that are high in low density lipoprotein because the risk class is very fatal later on if it is unresolved. Okay, so it could lead as far as your myocardial infarction. That's what we refer to again as your heart attack, and then your CVA or stroke class. No? So those are the possible complications. So ganon kahalaga yung pag-balance ng value ng ating cholesterol sa ating katawan. Now, if you would look at the cells class, there are various types. No? There are various components of the cells. And then if you would look at the structure of the human cell, there are actually a lot of organelles inside the cell. So pag sinabi natin class na organelles are the specific components that could be found inside the human cell. Now, speaking of these organelles, what is considered to be the chief organelle or the control center of the cell? Anybody?
Nucleus,
Okay, that
Nucleus.
would be your nucleus. Okay, that would be your nucleus. How about class if I will say, what is the powerhouse of the cell? What is the
Mitochondria.
your powerhouse is your mitochondria. Okay. Now, question. When I talk about your red blood cells, does your red blood cells have cilia or flagella? Meron bang cilia? Meron bang flagella yung red blood cells natin?
Cilia po.
Again? Yes, hindi ko narinig, sorry. Yes, meron ba?
Yes po. Cilia po ba?
Cilia, flagella. Meron bang ganon yung mga red blood cells natin, dear students, future nurses?
Meron po.
Red blood cells yung pinag-uusapan natin,
I
red
think
blood
po
cells.
wala. I think none since it is
Ibabalik ko kayo sa grade 1 pag magkagano. Okay, kidding aside, so class pag sinabi po nating cilia and flagella, this could not be found in our red blood cells because the structure of our red blood cells is shaped like a disc. Okay, our red blood cells, guys, is shaped like a disc. Okay, tingnan niyo po, yan po yung normal na itsura ng red blood cells natin. It's a disc-shaped discoid cell. Unlike the other cells of the body that would contain your cilia and your flagella. So in our body cells, wala po tayo. Okay, tingnan natin kung ano yung may mga flagellated cells. When we talk about flagella class, the purpose of your cilia and your flagella is actually to facilitate movement. No? So usually nakikita po natin yan sa mga bacteria wherein you will notice that there is a cilia. Pag sinabi natin cilia class, the keyword there is that it's hair-like projections. Okay, when we talk about cilia, it's your hair-like projections. Pag sinabi ko naman class na flagella, it's considered to be tail-like. Okay, so again, cilia is hair-like, your flagella is tail-like. With our cells in the body, we rarely see this, but instead we see the usual animal cell, okay, with all the organelles. Wala po tayong mga parts of the cell which is used for mobility. Okay, like your cilia and then your flagella. Okay, what else? Ano pa nga ba yung importante sa mga organelles natin? Let me see. Nucleus, I have talked about that, mitochondria. Okay. Now, class, there are different types of movement through the cell, passive at saka active. Pag sinabi kong the one that uses energy, is it considered to be passive or active?
Again po.
If it uses energy, is it considered passive or active?
Active po, sir.
Okay, yan yung keyword class na alalahanin natin. Pag gumagamit po siya ng energy, it's considered to be active transport. Okay, so class passive, kindly remember the types of your passive transport. For your passive transport, the three main types there is you have your D, if I'm not mistaken, it's DOF. Okay, DOF. So class, you have your what you refer to as diffusion. Then you also have what you refer to as osmosis. Then you also have what you refer to as facilitated diffusion. Okay, so that's for your passive transport. And then the other types class would already fall under your active transport. And what is that energy that is being used in your active transport? What is that energy being used for your
ATP.
active transport? Okay, very good class. Diyan papasok yung ATP natin. Okay, so class, remember your ATP, which is your adenosine triphosphate. Okay, adenosine triphosphate. Okay, sige. Now, what else? So, class, if you would look at the DNA and then the RNA, what is considered to be double helix with nucleotide? What is considered to be double
DNA, sir.
helix? So class DNA. Pag sinabi natin na it carries the genetic material, okay, genetic material, what would that be? Would that be your DNA or RNA?
DNA po.
Okay, that will be your
DNA.
DNA. Now, class, for your DNA, remember that there's a pairing there of your nucleotides. The pairing is best summarized by your CGAT. Okay, it's your CGAT. Whereas, class, for your RNA, it's actually CGAU. Okay, so the difference is that this is cytosine, guanine, this is adenine and thymine. Whereas, class, in your RNA, the U there stands for? What does the U
Uracil.
stand for? Okay, very good. Your U class stands for uracil. Okay, so ano pong ibig sabihin ng CG80? Ano? So class, when we are doing the DNA mapping, you will later on notice na, for example, this is the DNA map of the patient. Halimbawa, sasabihin, sorry, bakit nagkakaganon? Halimbawa, class, we will notice that the DNA map of the patient indicates CC. A, G, C, T, A, C, C. Okay? You will know that the pair of it will be, ano bang pares ng C?
G.
G. Very good. Pares ng C. G. Then the pair of A is T. This will be C. This will be G. Okay, this one will be A.
U,
E.
A, C, C.
T, at saka G. G. Okay? Hindi ko tinanggap yung U kasi yung U sa RNA. Ha? So this one will be true for your DNA, and then for your RNA, it will be a different story. Okay? So that's how it works now. That's how it works when you are talking about your, anong tawag natin dyan? When you're talking about your CG80 pairing. So the same is true plus when it comes to your RNA. However, instead of T, you will be using your U. Okay? Now, question. If I will be talking about the cells of our body, forever na nga ba na ganito yung cell sa katawan natin or does it change?
It changed,
Changes.
sir.
Change po, sir.
Okay,
Change
it
po.
changes, no? It changes. And that process of changing actually class is taken care of also by your apoptosis. Okay, we have the term class that we refer to as apoptosis. Ano pong ibig sabihin ng apoptosis? What do we mean by apoptosis?
Also known as cell death, sir.
Okay, class. So pag sinabi nating apoptosis, one of the keywords there that you need to remember is that it's your programmed cell death. Okay, so class, pag sinabi nating apoptosis, your apoptosis is your programmed cell death. Now, let's apply the concept when it comes to your red blood cells. Class, how long is the lifespan of our red blood cells? Anybody? Can
24
anybody?
hours?
3 to 4 hours lang, hindi ganon. Okay?
24, sir, 1 day.
24 hours, hindi ganon ka-ikli. Gano katagal?
120 days, sir.
Okay, may nagsasabing 120 days. How many months is that? How many months is that?
3.
120 divided by
4
30 days.
months.
Okay, so it will fall in 4 months. Okay? It will fall in 4 months. So class, paano po natin nasasabi na 4 months lang po yung lifespan natin ng RBC natin? So class, yan po ay dahil sa apoptosis. Okay? There is programmed cell death. In other words, after 4 months, I am sure that these cells of my body, will not be anymore here, but instead they will be replaced. And what part of the body nga ba yung nagproproduce ng red blood cells? What part of the body produces your red blood cells? Bone? What specific
Bone marrow.
component of your bone? Okay, very good. And what specific type of bone marrow? Meron tayong dalawa. May red bone marrow, may yellow bone marrow. What type?
Red bone marrow.
Red bone marrow.
Red bone
Very good.
marrow, sir.
Okay? So class, now, just for me to demonstrate what is apoptosis. So as what you have mentioned, your RBC would have a lifespan of 4 months. Ibig sabihin, class, 120 days. Every 120 days, these RBCs are being replaced by the production of your new RBC. So nagpro-produce po tayo ng new RBC, and that is the task of our bone marrow. Okay? And then magbabago naman po sila. Baka sabihin nyo, sir, bakit hindi ko naman na-feel na bago sila? Guys, hindi po sila sabay-sabay nag-change. Okay? Not all of your cells will be changed at one instance. Okay? So it's a continuous process on their part. Now, palagay nyo, what do you call the cell that lacks apoptosis? Anong cell kaya yung naglalak ng apoptosis?
Sickle cell.
Iba yung sickle cell, but it's a good try. I appreciate that. It's okay, no? Okay, since you mentioned about sickle cell, okay, magandang pag-usapan yung sickle cell. Tignan nyo class yung sickle cell. Okay, tinawag po yung sickle kasi po yung shape niya po is like that of a sickle. Okay, so that's why class it's referred to as your sickle cell anemia. Okay, tignan natin. Ano nga ba yung sickle? Okay, baka hindi kayo nagtatrabaho tapos di nyo alam kung anong sickle. Okay, so yan po yung tinatawag nating sickle. Kaya po tinawag na sickle cell anemia po yan. Kasi po kung titingnan po ninyo yung shape niyan, okay, parang nagkaganon. Okay, kita nyo yan. These are sickle cell anemia. Okay, this is contrary to what I mentioned earlier that the shape is, di ba, the normal shape, sabi natin, is discoid. Sabi natin, the normal shape is disc-like. But in the case of sickle cell anemia, it turned out to be like that of a sickle. Okay, that's why the patient would usually complain of pain, especially kapag nagka-clog, itong mga sickled cells on the minor blood vessels of the body. But allow me to go back to my question. What particular condition do you think wherein class the cells lack apoptosis and then at the same time class the cells lack differentiation? Anong cell kaya yon or anong condition kaya yon? Itong condition wala pang gamot, sabi nila.
Cancer, sir?
Very good. Cancer. Okay? So class, if you can see cancer, you would notice that if your patient has cancer, palaki ng palaki lang yan. Palaki ng palaki lang yung bukol sa katawan niya. Bakit palaki ng palaki ang bukol? Because class, there is no apoptosis. There is no apoptosis. They just reproduce. Okay, they just reproduce. They keep on reproducing without apoptosis. Okay, so if you would look at it with all due respect to this patient, now this is an example of a patient with breast cancer. So kung nakikita niyo yung bukol palaki ng palaki. Okay, so sir, ganun po ba yung breast cancer kalala? Hindi naman class, as nakikita ninyo, I search for stage 4 breast cancer already. Okay. Kadalasan lang kasi class in our setting here in the Philippines, one kasi of attitude that Filipinos would have is that let's not go to the hospital until it's worst or severe. Diba? Have you noticed that even in your family members or baka kahit kayo mismo? Diba yung ka-notice na kadalasan sinasabi, sige lang, wag muna tayong magpa-hospital, nakakahinga pa naman tayo. Wag muna tayong magpa-hospital, baka konting ano lang yan sa katawan. That's the problem when it comes to cancer because by the time that they will be in the hospital, they are already in the severe condition. Okay, so as you can see, class, these are cases of breast cancer. Okay, so palaki ng palaki lang yung bukol sa katawan, hindi naman class na bumabawas kasi nga walang apoptosis na tinatawag. Okay, are you getting the point? So when I say that there's something that lacks apoptosis that pertains to your cancer cells, okay? Plus, if you have seen patients like this, mabaho na po yan. Okay? Even before the pandemic, even if we are wearing double mask to handle these patients, you can still smell you can still smell that patient, the smell of the wound of the patient, even from afar. Okay? So kaya kung may mga pamilya kayo class, as early as now, you can actually educate them na kapag may nararamdaman po sila sa katawan nila, huwag na po nating hintayin na lumala. Okay? Let us not wait for that condition to be severe before we can act on it. Okay? So that's an important concept on your apoptosis. Now let's see. If you would look at class your SAS 3, one of the important things there that were mentioned is the term histology. Pag sinabi po nating histology, it is the microscopic study of the tissue structure. Okay? Tawag po niyan sa laboratory, may tinatawag po tayong histopathology. Okay, we have what we refer to as your histopathology. So ano pong ibig sabihin ng histopathology? In your histopathology class, the pathologist, that's a doctor, he will be able to see whether the cancer is on what stage. He will be able to see also if how your cells would look like under the microscope. And it's for them to identify whether the cell is still normal or not. Okay? Usually, class, when we talk about histology, kumukuha po tayo ng sample. Can anybody tell me what do you call that procedure wherein a sample is acquired from the patient? What do you call that procedure wherein a sample of a tissue is being acquired from the patient?
Biopsy, sir.
Biopsy, sir.
Very good, very good. So class, yan po yung tinatawag nating biopsy. So for example, if we are in doubt if our patient's class has cancer, the gold standard for the diagnosis of cancer is your biopsy. So what is being done in biopsy? Napakarami pong uri ng biopsy. I will show you one type here that is being referred to as FNAM. FNAM. Okay, tingnan natin kung kaya ni Google yung FNAM. Okay, very good. Ang galing talaga ni Google. Okay, so class, your FNAB refers to your fine needle biopsy. Okay, so class, your FNAB is your fine needle aspiration biopsy. Okay, this one is a good picture. Now, class, if you would look at this now, if you would look at this patient, the doctor is actually trying to get samples of the tissue from the neck of the patient. While I'm looking at the picture, I think, class, that this patient is being assessed for thyroid cancer. Okay, I think, class, the patient is being assessed for thyroid cancer. So ano pong ginagawa? Tulad ng sinasabi ko, FNAB. The procedure, class, is referred to as FNAB. So ang tawag po, ano pong ibig sabihin ng FNAB? That will be your fine needle aspiration biopsy. So in other words, there is a use of a needle that is penetrating towards the organ, and from that, class, it will be aspirated. Pag sinabi po nating aspirated, pinapalabas po, hinihila po from the katawan. Ay, that's your aspiration. And by the time, class, that the tissue samples will be collected, it will be placed by your pathologist under the microscope. Okay, so tingnan natin. Tingnan natin yung thyroid histopathology. Okay, so class, it will be placed under the microscope, and it is the pathologist that is trained to determine whether the cells are normal or whether this cells, class, is what is considered to be cancer already. Okay? Ako po is not trained on this. It is not my field of expertise. But as nurses, we need to know that this is how it is being done in the laboratory. So later on, if you would want to pursue medicine, one area, class, in medicine that is also interesting is your histopathology. Okay, your pathologist, usually they are doctors that would say they diagnose the patient without seeing them. Okay, they diagnose the patient without seeing them. Bakit nila, class, paano nila na-diagnose without seeing them? Because they just look into the tissues of the patient in the laboratory setting. Okay? Sige. So that's it, class, for your histopathology. I hope that you will be able to remember that. And then, if you would look at, class, your cells, so nakikita ninyo naman simple, meron tayong stratified, meron tayong pseudostratified, and then we also have your transitional cells. Now, bakit po natin kailangang tandaan? No? Bakit po natin kailangang tandaan yung mga cells po natin? Tingnan po natin. Wait lang. Esophagus. So if you would look at esophagus, class, your esophagus would have stratified squamous cells. No? Pag titingnan po natin doon sa table that can be found in your SAS3, you can notice class that your esophagus, okay, you have your esophagus. Hindi na marunong mag-type. Okay? So class, your esophagus would have stratified squamous epithelium. Okay? Pag sinabi ko pong stratified squamous epithelium, yan po, makikita po natin yung characteristic niya, that's the characteristic appearance ng isang patient na normal yung esophagus, isang pasyente class that the esophagus wherein is not damaged by the acids. Okay? Tingnan ko kung pwede kong mapalaki sa screen natin. Okay? So yan po yung tinatawag nating stratified squamous epithelium. So this is how your normal esophagus would look like. However, class, there are conditions wherein class the normal epithelium of your esophagus, okay, the normal epithelium of your esophagus is altered. So cells in, let's say, Barrett's esophagus. Okay. Barré esophagus class is already an abnormality. Barré esophagus class is already an abnormality in your esophagus. So ano pong makikita natin? Tingnan nyo po. Okay? Compare the cells on your left side and then your right side. Even with the naked eye, you will be able to see na, ay okay, magkaiba nga yung cells. Anong nangyari dito sa right side? Bakit ganyan po yung itsura? Ang tawag po niyang condition, as what you have noticed on what I've searched, is what you refer to as your Barré esophagus. And your Barré esophagus, spelled as Barrett, because your Barré esophagus is actually because of the recurrent exposure of the esophagus to the acid. Again, it is because of the recurrent exposure of the esophagus to the acid. Question class, pag sinabi kong esophagus, is it normally acidic ba? Pag sinabi kong esophagus, is it normally acidic ba, dear students? Guys, are you there?
No, sir.
Okay. Saan po yung acid natin? Earlier I mentioned. Where is it? Okay, very good, no? So class, your acid is supposed to be, okay, your acid class is supposed to be in your stomach, okay? Because it's the role of your stomach to digest our food, and the digestion would take place in the stomach, okay? Now, what happens class in your Barré esophagus or in your reflux diseases? Ang nangyayari po dito is this, no? So, the acid class which could be found here in the stomach would actually reflux going to the esophagus. There's a reflux of the acid going to the esophagus. Now, bakit po nag-iba yung cells natin sa esophagus? So instead of stratified squamous, because of the recurrent exposure to your acid from the stomach, these cells would be destroyed. Kung kaya class, nag-iiba po yung structure ng cells natin. Okay? So anong pong possible reasons niyan? Halimbawa, let's say for example, you ate a lot of chocolates, tapos you drank alcohol, tapos you're still doing smoking, there's a very high risk that you will have your condition referred to as GERD. Meron po tayong condition na tinatawag na GERD, G-E-R-D. What is GERD class? Your GERD is your gastroesophageal reflux disease. Okay, that's your GERD, gastroesophageal reflux disease. Do not memorize what's happening in the disease. Just understand class the term gastroesophageal reflux. Pag sinabi kong gastro, stomach. Esophageal, esophagus. Reflux, ibig sabihin, bumalik. Okay, reflux, di ba, is return. And that is the characteristic of your GERD. And ano po yung ina-apply natin dito? Yung concept na if a part of the body, if a part of the cell is continuously exposed to stress, the tendency is that there will be cellular changes. Okay? Now, once class there will be cellular changes, the tendency is that your patient will also be at high risk for cancer. Okay, the tendency class is that your patient will also be at high risk for cancer. Okay, kung kaya students, kaya kung naninigarilyo po tayo ngayon, tsaka medyo marami po tayong bisyo sa buhay. Okay, let's say for example, you're consuming a lot of alcohol, then mahilig tayong mag-night out, you're smoking, okay, or whatever activities you're doing to your body, I would tell you, class, do not abuse your body. Okay, do not abuse your body, because I have seen already a lot of patients and they don't end well in the hospital. Okay, they don't end well in the hospital. Wag na kayong maghintay na you will age at around 40, because it might be late already for you to change your mind about the smoking habits, about the alcohol drinking habits. Remember that these conditions is considered to be cumulative. Okay? Plus, pag sinabi nating alcoholism at saka nicotine that can be found in your smoking, the effect on the body is said to be cumulative. Ano pong ibig sabihin ng cumulative, guys? No? It means that it's being stored in our body. Okay? It's being stored in our body. Halimbawa, if you have been smoking for 10 years already, hindi po pwede po na one day when you wake up, no? Hindi po pwede na one day when you wake up, kaya sasabihin mo magbabago na ako, hindi na ako mag-smoke. You cannot immediately reverse the effects. Okay? You cannot immediately reverse the effects. So, ano pong advice natin sa pasyente natin? Dapat po as early as now, okay? Dapat po as early as now, okay? Let's stop. Okay, let's stop your smoking na and stop your alcohol drinking, because a lot of the patients that I encounter in the hospital at the age of 50 would say na, nurse, sana hindi na ako magsusmoke. Or nurse, ano nga bang tawag? Sasabihin nila na nurse, magbabago na ako. Yun yung mga drama eh. Kapag madadiagnose na may lung cancer, magbabago na daw. Pero by the time that you have your lung cancer, it's already too late. Okay, by the time that you will have your lung cancer, it's already too late. Okay? So if you have family members, hindi maiiwasan. Tinitingnan ko nga yung mga pagmumukha ninyo. Kaya hindi maiiwasan, Hindi maiiwasan na sa pamilya, there's somebody who always smoke and then somebody who drinks alcohol. So as early as now, educate them. Okay? You are in a position as a soon-to-be healthcare professional to educate them. Okay? Other than that, guys, please be mindful also that when you talk about smoking, when you talk about alcohol drinking, the effect is not only to the patient who is taking the alcohol and then the smoke. Okay? Smoke. Have you heard of secondhand smoke? Okay?
Yes po.
And then plus,
Yes, sir.
meron din tayong tinatawag, okay? Meron din tayong tinatawag na third-hand smoke. Meron din tayong tinatawag na fourth-hand smoke. Okay? So, So class, ano pong ibig sabihin ng third-hand smoke? Halimbawa, I'm smoking. Okay? Pagkatapos halimbawa, magkatabi kami halimbawa ni how do you pronounce this? Milieka. Okay? Is it Milieka?
It's Malaika, sir.
Ay, Milaika. Okay. So halimbawa, magkatabi kami ni Milaika. Milaika would have second-hand smoke. Okay? Now, for example, if Shifra would go here in my room, kaya halimbawa, she visited my office, and then na-inhale niya yung mga natirang smoke sa table ko, sa curtains ko, your Shifra would have third-hand smoke. Okay? And class, yung effect almost the same lang. Kung kaya, for example, alam niyo may mga cases akong na-meet wherein yung pumupunta sa hospital, yung wife, sinasabi yung wife may lung cancer na daw, tapos hindi naman siya nagsusmoke. Sino yung nagsusmoke? Yung husband niya. Okay, so, okay, if I'm not actually threatening you, pero I'm telling you the real picture. Because as in, sa hospital, makikita nyo, nasa huli talaga yung pagsisisi. Okay, and it's too late sometimes, no? It's too late sometimes. Now, there are different muscle tissues also that you can encounter in your body. Okay, if you would look at the muscle tissues, you have your skeletal muscles, you have your cardiac muscles, and then you have your smooth muscles. Okay, now among these muscular tissues that you have, again, you have your skeletal muscles, you have your cardiac muscle, and then you also have your smooth muscle. Now, class, sa mga tissues po natin ito, okay, what can you notice is that there is something that's voluntary and meron pong involuntary dyan. Sino po yung considered voluntary among the three?
Skeletal and
Who is
cardiac.
having
Skeletal.
cardiac ba? Naging voluntary na ba yung
Skeletal lang
cardiac?
Skeletal lang.
Okay, skeletal lang, Skeletal lang, okay? Okay lang. Yung mga sumagot ng cardiac, sana matutunan nga natin, Kasi hindi mo naman pwede daw sabihan yung puso mo na wag titibok, di ba? Okay, di ba sabi nga nila, if you fall in love, wala ka daw choice. Okay? So since you're learning anatomy and physiology, you know that's not true. You actually have a choice. Because what controls your emotion? Is it your heart or your brain?
Heart.
Uh-huh. What control your emotions? Is it your heart or your brain?
Brain.
Okay. So class, the
Central
control of your
nervous system.
emotions. Yes, the control of your emotions is actually coming from your central nervous system, your brain, and specifically your hypothalamus. Okay, specifically your hypothalamus. Kaya nga sabi nila, if you would want to express your love daw, do not say I love you with all my heart. Instead, you should say I love you with all of my hypothalamus because it's your hypothalamus that triggers emotions. Okay? But anyway, yung sinasabi ko lang naman is guys, yung heart natin involuntary. Bakit involuntary? You cannot tell your heart na, o sige nga, mag-stop ka muna, pahinga muna. Or heart, bilisan mo nga muna, may exam ako, kailangan ko ng sagot. Okay? Hindi pwede. It's involuntary control. Okay? The only voluntary here is your skeletal muscles. Your smooth muscles class is also considered to be involuntary. Relate kayo nito, ladies. Di ba? If you're having your uterine cramps, okay, menstrual cramps, pwede mo bang sabihan na, oy, huwag ka munang mag-cramps. Okay, may exam pa ako, okay, huwag ka munang magtakit. So, hindi naman pwede because it's involuntary control on our end. Okay, and plus, the involuntary control is usually taken care of by, meron tayong dalawang component ng peripheral nervous system. So, you have your somatic and then you also have your autonomic nervous system. Sino po kaya yung sa involuntary? Is it the somatic or the autonomic?
Somatic.
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 Sige, hula-hula lang tayo, hula-hula lang. Okay? So, class, ganito yung isipin. Involuntary siya. Ibig sabihin, gumagalaw siya, di ba? Kahit hindi ko ginugusto. In other words, automatic siya. Autonomic nervous system. And under your autonomic nervous system, dear students, you have two branches there. You have your sympathetic nervous system, and you also have your parasympathetic nervous system. Okay, so you have your sympathetic nervous system, and then you also have your parasympathetic nervous system. Okay, you will be touching on this when you have your neurologic system para mas matandaan ninyo. When you are studying your sympathetic nervous system, think of, bakit mga flight? Okay, think of fight or flight response. Okay? Yung parasympathetic nervous system naman, usually, we remember it as rest and digest. Okay? Now, ano pong ibig sabihin ko ng fight or flight response? Ganito lang po. Pag sinabi kong sympathetic and parasympathetic nervous system, they work together, class, in order for us to have balance in our body. Okay? Para po maging balance yung pag-function ng katawan natin. So, may isa po dyan that would increase your heart rate, may isa din dyan na magdi-decrease ng heart rate mo. Tulad ng negative feedback mechanism na pinag-usapan natin kanina. That's your sympathetic nervous system so that you can remember, there are a lot of things happening in the sympa nervous system. For you to remember that, class, you remember sympa nervous system as your fight or flight response. Okay? Now, ano pong fight or flight response? Isipin nyo na lang, class, hinahabol kayo ng malaking aso. Okay? You think of yourself that you're running away from a big dog. Okay? And then, kumbaga, you're running for your life. Kasi gusto kanyang kainin, no? Parang ganun. So, class, ano po kaya magiging tendency if you have your fight or flight response? What do you think happens to your heart rate?
Bibilis po.
More like
Okay.
adrenaline rush.
Very good, no? Nag-adrenaline rush. I would like that word, no? I would like that word. Meron kang adrenaline rush. Okay? So, class, in fact, your adrenaline is among the hormones being released by your sympathetic nervous system. Okay? Yung adrenaline rush na yan na tinatawag natin, it's actually your sympathetic nervous system at work. Okay? Pagkatapos, so, class, ganyan yung heart rate mo, mag-i-increase. Ano kaya mangyayari sa BP mo? Your BP would also?
Increase.
Okay, mag-i-increase din po siya. Okay? Now, class, si pupils. Anong mangyayari kay pupils natin? Will it dilate or constrict?
Dilate.
Dilate.
Okay, magdadilate yan, magdadilate. Okay? Ganito lang isipin nyo, halimbawa, kapag kaharap nyo yung mga boyfriend nyo, na akala nyo forever nyo na sa buhay. Di ba? Pag naka-eye to eye kayo, parang nagdadilate talaga yung pupils mo. Nang lalaki talaga yung pupils mo kasi focus ka talaga sa boyfriend o kay girlfriend mo. Akala mo may forever na kayo. Okay? So nagdadilate po yung pupils natin. Dito naman sa scenario na hinahabol ka ng isang aso, guys, why is your pupils dilated? The dilated pupils would allow you to focus. Okay, the dilated pupils would allow you to focus on your way para hindi ka madapa, hinahanap mo na yung bato, hinahanap mo na kung saan ka liliko, saan ka aakyat para you will run away from that dog that's running after you. Okay? Another thing, class, is what happens on your GI system? Feeling nyo, in this case na naghahabol tayo ng oras, tumatakbo tayo, heart rate increase, blood pressure is increased, what do you think happens to your gastrointestinal system? Is the functioning increased or nagdi-decrease?
Increase po.
Increase po.
Mhm. So, class, pag hahabulin kayo ng aso, magtatae muna kayo, parang ganun. Okay? Biro lang, para maalala nyo lang. So, class, pag hahabulin tayo ng aso, wala na po tayong time para magtae. Okay? Di ba? Wala na po tayong time to urinate. Instead, tatakbo tayo. Kakalimutan natin yung lahat. Just to remind you guys that in the sympathetic nervous system, the GI system is down. Okay? Now, class, pag sinabi kong GI system is down, when it's down, it's not moving, the tendency is that you will have constipation. Okay, the tendency is that you will have constipation. Okay? That's why one thing that I also tell my students is that when you're studying sympathetic nervous system, remember that the actions are dry. Okay? Other than the flight or fight response, no? So the reactions are also dry. In other words, decrease yung ihi. Decrease din yung class yung pagtatae. Okay? Why is that so, no? Sir, why is it that the GI functioning is decreased? Because the blood flow is prioritized on your major organs. The major organs of your body being your heart, your lungs, and then your brain. Okay? Kasi gusto nating tumakbo. So, prioritize na dapat si heart, si lungs, tsaka si brain ready for you to run away. Okay? Now, once there is aggravation na of SNS or sympathetic nervous system, negative feedback. Sasabihin ni parasympathetic, uy, sympathetic ako naman. And your parasympathetic nervous system would have the rest and digest. Okay? So anong ginagawa ni parasympathetic nervous system? Si heart rate pinapa-decrease. Si BP class nagdi-decrease. Si pupils class nagko-constrict in a parasympathetic response. Kaya nga siyang tinawag na rest and digest because this time, ang magiging bida na naman po is your gastrointestinal and your genitourinary tract. Okay, ang bida na naman is your GI and your GU. In other words, may time ka nang kumain, may time ka nang umihi, may time ka nang magdumi or magtae. Ay dahil tapos na yung drama mo na hinabol ka ng isang aso. Okay? So if you would be looking into your nervous system notes, okay, it's not as simple as this, but try to connect it to that. So try nyo itong alalahanin, fight or flight yung sinabi ni Sir versus rest and digest. And then if your sympathetic nervous system is on the dry, your parasympathetic nervous system would have the wet responses. Ano pong ibig sabihin ng wet response? Okay? So class, in other words, for example, the stomach, what do you think happens on the acid production? Will it increase or decrease in parasympathetic nervous innervation?
Increase.
Mag-i-increase siya. Mag-i-increase siya. Diba? Kasi sabi ko, rest and digest. So class, para marami yung madadigest, nag-i-increase na naman yung acid production. Okay? So that's how amazing our body is, no? The balance between your sympathetic and your parasympathetic nervous system. And to tell you, to go back to the muscles, your cardiac muscles and your smooth muscles are actually controlled and regulated by your sympathetic nervous system and your parasympathetic nervous system. Okay? That's how amazing it gets. Okay? So I hope that you will be able to apply that in your future lessons as well. Okay? Now, you would also notice that you have different types of membranes. Okay? Ang isa dyan is you have your synovial fluid or your synovial membranes. Just remember, dear students, that when you talk about synovial fluid, your synovial fluid could actually be found in your joints. Okay, when you talk about your synovial fluid, it could actually be found in your joints. Okay, synovial joint. Okay, so class, ang joints po natin, okay, kung makikita po ninyo, meron po yung fluid in between. Pag sinabi nating joints, that's where your two bones meet. Okay, if you can recall, that's where your two bones meet. And then class, in that joint of yours, there's a synovial fluid. And the purpose of that synovial fluid is to prevent friction and to prevent pain between your two bones. Okay? Can you recall those so far? Sige. Class, so far may mga questions kayo in mind sa mga topics na nabasa na ninyo?
Wala.
Sir, napakarami kasi talaga, sir, ng dapat basahin. Parang wala na kaming time magtanong sa self namin. Okay? Ganito na lang muna yung tanongin niyo sa sarili niyo. Who produces vitamin D, guys? Who produces vitamin D?
Sun?
Ayan, sun, di ba? Yan kasi turo sa atin nung elementary. Sabi nila talaga si sun talaga yung nagpo-produce ng vitamin D. Ano? Okay? So class, on the next topic, you would notice the importance of your skin. Okay, class, your skin is actually considered to be the major protector of our body. Okay, it's considered to be the protector of our body. It's actually also our barrier from foreign organisms. So class, actually, it's not about the color, whether you're white, you're brown. It's not about that. The main feature or the main importance of your skin is that it protects our body from foreign organisms. It protects our body from the environment. It also makes our body warm. Okay, those are the main functions of your skin or what we refer to as your integumentary system. Okay, so pag titingnan natin, pag tatanungin kayo, what's the biggest organ of the body? The biggest organ class of your body is your skin. Okay, biggest organ po natin of the body is your skin. If they will be talking about the biggest internal organ of the body, that will be your liver. Okay, the biggest internal, yeah, that's the liver, the biggest internal organ. So guys, related dun sa tanong ko kanina, kung what produces vitamin D, plus the formulation of vitamin D is actually taken care of by your skin. Okay, so class, yung nagproduce po ng vitamin D natin is actually your skin. Sir, ano po yung role ng sun? Kasi for my entire lifetime, pinapaniwala po talaga ako na sun po yung gumagawa ng vitamin D. Sabi po ni nanay, sabi po ng aking mahal na mama, lumabas ako daw by 8 a.m. kasi kailangan ko ng vitamin D from the sun. Okay? Plus, the role of your vitamin D is the role of your sun, is only to activate vitamin D. Okay? Plus, the role of your sun is only to activate vitamin D. Sir, saan nanggagaling yung vitamin D? Sa mga kinakain natin. Okay? Fruits and vegetables would contain vitamin D. The meat products would also contain vitamin D. And these products, class, will be stored on our skin. By the time that the sun rays will shine upon us, okay, what would happen is na-activate yung vitamin D natin. Okay? And vitamin D is important for what electrolyte? Anong electrolyte sa katawan natin yung hindi kayang mag-function na wala si vitamin D? Sige na, is it your potassium? Is it your magnesium? Is it your calcium? Or is it your sodium? Vitamin D. It helps on the absorption of sige, okay lang mahula. Calcium, sir. Pero nagdadalawang isip. Okay? So, class, si vitamin D is the partner of our calcium. Okay, class, vitamin D is the partner of our calcium. Vitamin D, class, helps on your calcium absorption. So, ganito guys, hindi po pwede na iinom lang po kayo ng gatas tapos matutulog sa isang kuweba at sasabihin nyo na magiging healthy yung bone ninyo. Okay? Because your milk will just be calcium that will go inside your body, go out through your rectum, go out through your small intestine. Without vitamin D, it will not be absorbed by your body. Okay? So that's why if you can notice, baka nanonotice nyo si mother natin. Pag si mother natin, kapag may mga vitamins yan, kaya halimbawa, Caltrate Plus, hindi po ako nag-i-endorso, wala pong bayad si Caltrate Plus sa akin in case na bibili kayo. Kaya pero class, tingnan niyo po yung components. Calcium plus vitamin D3. Ay, bakit sinabay? Kasi class, the vitamin D will help in the absorption of your calcium. Okay? So ganun po yung rationale kung bakit po natin sila pinagsasabay. Which goes without saying that if I'm dealing, for example, with a burn patient, okay, if I'm dealing with a burn patient, other than the problems of pain, syempre masakit yung burn, no? Kayo kaya masunog. Okay, pagkatapos class, other than the concern na pumangit siya, the disturbed body image, another concern class that you will have is that your patient may have calcium deficit because the skin is unable to process for your vitamin D. Okay? So tingnan nyo, mga burn. Tingnan natin yung mga 80% burn. Para ma-imagine nyo naman kung gaano kalala yung mga burn. Okay? Ay, sobrahan naman to. Baka edited naman yun. Okay? Ay, mayroon talagang ganon. Okay? Oh, I think this is true. Okay, it's a true burn victim, guys. No? Okay? I think it's a true burn victim. Okay, I'm so sorry I'm not aware of this case. Okay, I think he's a true burn victim. Okay, so class, imagine if you have burns no, of this type, calcium will be a problem. Calcium will even be a problem in our body. Okay? Parang nagdadalawang isip ako kung totoo. Uy, I see. Okay, I will read on this later on para yan kumbaga yung study material natin mamaya, no? So, sasabihan mag-aral ng TikTok tapos hanapin kung anong chika dito sa burn patient mo to. Okay, so class, that's how important, no? That's how important when you're talking about the skin. That's how important your skin is. Other than that, no, other than your vitamin D production, and other than saying that your skin protects us from barrier, protects us, I mean, or acts as a barrier for foreign organisms. Your skin class also regulates your temperature. Okay, your skin class also regulates your temperature. In other words, isang problem po natin sa among the patients with burns, they also become hypothermic. Okay? Di ba kadalasan as lay people, our concern is, uy hala, may fever. Kasi hindi lang fever yung problema. The normal temperature of the body is said to be 36.5 to 37.5. Okay? Plus, if the temperature will be lower than 36, it's already considered to be hypothermia. And if your patient class is hypothermic, mind you, it's also a problem because the processes of the body is being decreased, the metabolism of the body is being decreased, it may even lead to cardiac arrest. No? So, example, if your patient has burns, the body is unable to regulate its temperature. And the tendency is that your patient would become sick because of hypothermia. Okay? Now, another important concept na gusto kong i-touch doon sa ating skin is that you have the different layers of the skin. So you have your stratum basale or germinativum, stratum spinosum, granulosum, lucidum, and corneum. Okay, so kindly memorize that. But I would want you to focus on stratum germinativum as of this time. As you can see, it is being described as the deepest layer and it is undergoing your divisions about every 19 days. Okay? So mga 19 days daw class, ibig sabihin, do we change our skin? Are we changing our skin?
No po.
Okay. Nag-change ba yung skin natin or forever na ba tayong ganito? Okay?
Change mo siguro.
Nag-change po siya, no?
Mag-generate
Okay.
lang siya ng cell.
Maintain siya.
Yes, nag-generate siya kasi nga sir, mga mukhang ahas tayo, di ba? So parang ganun. Now, so class, ano pong nangyayari? Nagpapalit po yung skin natin every 20 days. Okay, every 20 days. But there is a condition wherein class, there is hyper-excitability of your stratum germinativum. Class, nakakita na ba kayo ng, or if you know somebody na nagsiscaling yung skin, class? Have you met somebody na nagsiscaling yung skin? Wala kayong nakitang ganon? Okay, kayo na. Mga healthy talaga yung mga kakilala nyo sa buhay. Tatanungin ko pa sana. Okay? So class, there's a condition being referred to as psoriasis. Okay, so class, ito po yung condition na psoriasis. Kung nakikita nyo, nagsiscaling po yan. Okay, scales po, no? So, like this one. Okay, this one is an example of your psoriasis. Okay, now, how do we connect that to the concept that you have in ANAFI? So, class, if you would look at stratum germinativum, it says there that the skin mitosis occurs every 19 days. No? It occurs every 19 days or 20 days nga in other textbook. Now, class, what happens in conditions such as your psoriasis? Plus, your patient is having the skin replaced as fast as every 3 days or every 5 days. Okay, there is a hyper-excitability of the stratum basale or the stratum germinativum. Instead, class, na 20 days dapat, ang nangyayari super excited siya. Parang every 3 days, every 5 days, nag-change siya. And for that reason, class, your patient would appear to have scaling. Okay? Okay, your patient would appear to have parang kung iba pa sasabihin nila parang dandruff-like appearance. Pero hindi po yan dandruff. Ha? Hindi po yan dandruff. Okay? So yan po yung appearance ng isang patient na may psoriasis. Now, class, your psoriasis is usually considered to be an autoimmune disease. It's considered to be an immune response and usually triggered by stress. Okay? Halimbawa, I have encountered a case na she has been well from until college years, but when she took law school, okay, she found out that she has psoriasis because of the stress that she encountered during law school. She is working in the morning, in the afternoon, she's going to law school, and then she's memorizing a lot of concepts at night. Medyo kulang ng tulog. So what happened is that she had psoriasis. Okay? Maraming ganito. Tapos seasonal ito, guys. Usually, it would appear at around the months of April to June, related to the summer weather. Okay, so that's one example, your psoriasis. Okay, any questions so far, my dear students?
None so far po.
Sige. So, huwag mahiyang magtanong. Yes. Sige. So, class, I will be ending the session here right now.